My name is Adrian Sell. I'm chair of the Bond Group focused on mental health and psychosocial disability. I'm actually a freelancer. I'm doing some work at the moment with Time to Change Global, who are looking to pilot anti-stigma programs in low middle income countries based on evidence from the global north to see if it applies in the global south. In summary, we don't have a raft of off-the-shelf programs that are ready to go. We know there are some promising approaches. We know there are things that have been tried on small scale and subject to research with some promising findings, but there aren't many, if any, approaches which have been tried across multiple countries globally in multiple different settings. Basic needs model for mental health and development, which brings an approach to development in mental health which incorporates self-help groups and incorporates a livelihoods element, so groups come together and identify activities they can do in their local community. It may be managing livestock, buying that livestock with a small grant. It might be buying some craft materials and getting training in craft projects. It might be setting up a community shop, but it's normally something that is valued then by the local community and gives them some status and standing in the local community, and also keeps people engaged with the group. It gives the group what we call stickiness, and we know that people get a lot of social value from being part of a group. So if you can keep people engaged in that group, that's a very, very positive outcome. We know that social connectedness is a very important thing for people's mental health and well-being. And if you can have programs that enhance social connectedness, develop people's membership of groups, keep people engaged with groups, then that's going to be a very good thing for their mental health and well-being. If you can increase mental health literacy in a community, you're reducing stigma, you're making it more likely that people will reach out and ask for help, and you're also making it more likely that when they do talk to somebody in their community, the response they get is useful and supportive and helps foster an environment of positive mental well-being that is good for everybody in that community. And it increases the capacity of the community to be able to look after people with more severe mental health conditions in their community. I think inclusion is also a crucial issue that can be used in mainstream programs to make sure you're thinking about how you can include people with a psychosocial disability or mental health condition. That helps break down the barriers and make sure that the programs that are being put in place are accessible and not excluding people with mental health conditions. But we had some good examples of a schools program where they were incorporating psychosocial support for people with mental health conditions and counselling support for people with anxiety or depression as a result of their life experiences or the pressures they're feeling in school. So there are quite easy ways that a mental health component can be incorporated into an existing program that strengthens it and builds on it and helps people. If you have a program which is improving access to education, reducing poverty, reducing inequality, improving access to existing services, all of these things will be helping to improve mental health and well-being. So just adding in a measure that captures that will help add something to your program and help demonstrate another added value that your program is offering.